Hello, this is Luis. Welcome to the HDTV updates from the IDF World Diabetes Congress 2022. Today we bring you the Day 2 updates of IDF 2022. Bailey presented a session on the role of SGLT2 inhibitors across the cardiometabolic-renal risk spectrum, emphasizing that SGLT2 inhibitors have the potential to achieve metabolic control, offer cardiovascular and renal protection, and have a place in major guidelines in patients with established ASCVD. SGLT2 inhibitors slow the rate of eGFR decline, improve renal composite, and decrease albuminuria. Several clinical trials have revealed renal protective effects in patients with CKD and albuminuria. In addition, the landmark trials such as DAPA-CKD and PA-Kidney revealed positive renal effects in people with and without diabetes. Colagiuri S. spoke at a session on the new face of sulphonylureas in the era of newer OADs, emphasizing that sulphonylureas should not be regarded as the ugly duckling of OADs. Sulphonylureas control glycemic levels, reduce macro and microvascular complications, are safe, easily accessible, inexpensive, and well tolerated by patients. Sulphonylureas are still recommended as a second line of treatment by major guidelines. Newer agents can help with T2DM management, but in areas where resources are scarce, a more pragmatic approach is required. Even if the cost of newer agents fall, the benefits of sulphonylureas will be supported by robust and long-standing evidence. Bailey C. spoke at the 65 Years of Metformin session. Metformin has occupied first place in all major guidelines since its synthesis in 1922. Its favorable effects on glycemic levels and cardioprotective effects keep it as a first-line therapy for T2DM. Rossing stated during a session on the cardioprotective mechanisms of SGLT2 inhibitors that a high dose of dapagliflozin improved renal oxygenation in people with type 1 diabetes and albuminuria within 6 hours with no indication of a change in renal oxygen supply. By reducing inflammation and fibrosis, such improved oxygenation may contribute to the long-term renal beneficial effects of SGLT2 inhibitors. However, it remains to be seen whether the observed effects are sustained with chronic treatment at lower doses and whether they also occur in type 2 diabetes. Tesfaye presented the findings of the latest clinical trial evidence on painful diabetic neuropathy, option DM, which found that amitriptyline, duoxetine, and pregabalin are all equally effective. This is the first study to examine treatment pathways, the longest comparative effectiveness study in diabetic peripheral neuropathic pain patients, and the only one to include more than 2 medications. Combination therapy results in a further numerical rating scale drop of 1 and greater pain relief when compared to monotherapy. In addition, he stated that combination therapy is well tolerated. This concludes our coverage of the HDTV updates for Day 2 of the IDF 2022. We'll meet again tomorrow. Have a good day.